Hi, my name is Johanna Georgilakis, and I am a second year student at the Grand Canyon University in the master's program of addiction counseling. Today, I'd like to share with you a brochure that I've been working on that that talks about addiction and some of the co occurring disorders that go along with that, to include stress and anxiety, generational, racial trauma, um, certainly family dysfunction, all play a part in considering the holistic approach to treating addiction and selecting the proper therapies to do that. Um, Addiction, which is defined as a compulsive behavior, um, can include substance abuse. It can also include non-substance risky behaviors or compulsive behaviors. Managing this disorder it's quite difficult, and trying to navigate the waters and find the proper therapeutic approach can be very taxing on families and individuals. Um, and it can affect quality of life, like job and personal relationships. Those who are also suffering from co occurring disorders like depression and anxiety need a multifaceted, integrated approach to treatment in order to address both disorders while taking into context the uniqueness of the client, which considers um, their cultural norms and their practices and their beliefs and their values and how they view themselves in the world and the world around them. So the two that I've chosen are cognitive behavioral therapy and motivational interviewing. These strategies are often used together because they complement and support one another. Cognitive behavioral therapy is a goal-oriented strategy that tries to enhance the person's everyday life functioning. It also serves to address negative or distorted cognitive processes by reframing, looking for a positive approach, and maybe just modifying the way that people go about solving problems, looking for personal strengths, previous experiences. Um, it is known for three stages, which include identifying negative thoughts, using new techniques to reframe and change those, and also to integrate coping skills and processes that can help them along the way. Again, utilizing and looking for inner strengths, working from a strengths-based perspective. Motivational interviewing works in tandem with this evidence-based approach because it looks to understand the client's motivation for wanting to change the behavior. So we're looking for the intrinsic value and why the client really wants to look at this change, why they want to address their addiction disorder and potentially the stressful anxiety, social and familiar dysfunction that might be driving this disorder. It employs using the client's input, making the client very active in the therapeutic process. So oftentimes in the beginning, the client feels as though the therapist knows more than they do. But the goal of the therapist is to um, support the client in a way so that they begin to recognize their own strengths and abilities to improve these behaviors, and therefore they contribute to the process and to the strategy and to the treatment plan. Um, with cultural considerations, um, these two have worked well together when working with minority cultures such as the Latin and Hispanic population. A lot of the acculturation, stress, and trauma that these societies go through, that these cultures go through in Western cultures, often involve a component of stress and anxiety, which lead to substance use. So the integration of these two strategies would be useful in targeting these stresses, such as discrimination um, and low status um, work issues, And then, of course, maybe being separated from family members and having to acculturate to a new culture, learn the language, and try to fit in. Anxiety disorders are very common in Latin Americans, especially Mexican descent, who were born in the United States. They suffer from depression, and oftentimes low-incoming Spanish-speaking residents respond well to cognitive behavioral therapy because it analyzes and reframes thoughts and cognitions and behaviors, but it takes into consideration cultural assumptions and works to identify the client's needs from an intrinsic basis, from within, so that they are motivated to stay in change, to stay in treatment, and they continue to be a part of the therapeutic process. So counseling techniques for CBT do overlap with motivational interviewing in the cognitive restructuring, managing goals, and practicing self-regulation and an awareness of one's problems and the desire to want to change. So thank you so much for listening, and I hope you have a great day.